Hi guys, my name is Dr Sandhya Ramanathan and I'm a GP in Grey Lynn in Auckland, and today I just wanted to share with you a few tips and a few simple over-the-counter remedies you can keep stocked up in the cupboard to help protect you and your family members as we navigate through this COVID-19 pandemic. The information about COVID-19 is rapidly evolving and can sometimes be a little bit overwhelming. What we do know about COVID-19 is that generally it enters through our nose and our mouth and causes an upper respiratory tract infection. So today I just wanted to go through the basics of how we can protect ourselves and what things we can use to try and alleviate any symptoms of an upper respiratory tract infection and try and minimize the duration of the illness in doing so. Now, the main symptoms which we can get with COVID-19 are similar to any cold or flu which you may have had in the past. They include things like sneezing, running nose, sore throat, cough, fever, and sometimes a loss of sense of smell and a loss of taste. You can also get shortness of breath, and if you are to get shortness of breath, this is an indication that you need to seek medical advice straight away. Now, our first port of defense in fighting any infection is a healthy immune system. We can all work to improve our immune system by eating well. And by eating well, I mean having a diet rich in fresh vegetables and fruits of all the different colours of the rainbow. This ensures that we're getting a good intake of antioxidants, which helps us fight infection. In addition to eating well, we need to make sure that we are exercising, and that's especially important while we're in lockdown and we're not expending the amount of energy that we normally do. It is also important that we try and reduce our stress levels as much as possible, because when we are stressed all the time, we are in a constant state of fight or flight, and that is not good for our immune system. We need to reserve our fighting spirit for when we actually get an infection. In addition to this, it's very important that we stay connected to our loved ones either by phone or by teleconferencing. Now, if you are to come down with viral symptoms, it's very important to start fighting them straight away. Generally, I recommend starting an immune boosting supplement at the first sign of infection. A good one to look out for is something that contains vitamin C, zinc, and echinacea. Another good one is turmeric. If you are to use a multivitamin, look out for something that contains some vitamin D, especially as we enter the winter months, and also while we're in lockdown, we're not getting as much sunlight exposure as we usually do. When we start getting symptoms of sore throat or running nose, this is a sign that we are having virus particles in our upper respiratory tract, and it's very important that we start working to reduce the viral load at the point of contact. So at the first sign of a sore throat, it's very important that you start doing gargling twice a day with warm salty water. Even better than that would be an antiseptic solution such as betadine, which comes in a ready diluted or a concentrated formulation. If you're allergic to iodine, however, you could try something like a Savicol antiseptic mouth rinse or even a Listerine mouth rinse. But otherwise, salt water and even a saline nose rinse will help reduce the viral load. If you do get a running nose, often it drips forward, but sometimes it just drips backwards, causing a tickle in your throat. This is known as postnasal drip. It's very important to get on top of these symptoms because postnasal drip is one of the most common causes of cough. So the sooner you can dry up the nose is the sooner you can try and prevent the infection going down into your chest. Generally for my patients, I recommend that they get some Otrivin nasal spray. This is Otrivin Plus, but plain Otrivin is fine. There is also an Otrivin Junior nasal spray which you can use in children. In addition to this, you can use Sudafed or MaxiClear. This contains 10 milligrams of plain phenylephrine, and this can be used in children over 12 or adults, 1 tablet every 4 hours. It doesn't cause drowsiness, and it helps unstuff your head and clear up your nose. In addition to this, if you are to get pain or fever, generally I recommend that you stick to paracetamol. This is a much safer medication than ibuprofen and will help alleviate any symptoms. If you are to get a cough, even if breathing is painful, it is very important that you try and keep up some breathing exercises. Simple things you can do is try and hold your breath for 10 seconds. You can also try and keep yourself mobile even if your energy isn't so good by doing some gentle stretching. If you do have any questions, you need to refer to the New Zealand Ministry of Health website. There is a lot of information there about COVID-19. If you are worried that you may have COVID-19, then it is best that you call up the health line or you speak to your GP for advice. But remember to stay calm and to stay well, and together we can fight this.